Okay, thank you very much. Welcome to Labor and Health. Small crowd, small committee this morning. Let's go ahead and take roll real quick.
Senator Barlow,
Excused?
Senator Bouchard,
Excused?
Senator Dockstader,
Here.
Senator Hutchings, Chairman Baldwin.
Here.
We have 3 present and 2 excused, Mr. Chairman.
It's a quorum. Kind of. Okay, welcome. What we're hearing this morning is House Bill 24. We talked about this at length the other day. We're going to complete that today. My plan is this, and we may actually get through that quicker than I had planned, but the plan is to take a half hour, 15 minutes pro, supporting, 15 minutes con, opposed to the bill. I'll hear both those, then we'll close public comment. Committee will talk amongst ourselves or in front of you, and then we'll go ahead and take a vote on the bill. That's the plan, so we get this done. And I will forewarn you, I have to slip out for a few minutes. I think I've heard a lot of testimonies. I think we're good. I'll just be out for a couple minutes and I'll be right back. But I will be here before we discuss it and vote on it. So with that in mind, the bill essentially, the certificate of need, it's a very short bill. Certificate of need, of course, is something that's been in place for some time now. This bill just repeals that certificate of need, which talks about the construction and expansion of facilities. That's the bottom line, and that's what this does. This would repeal that portion or that part of the bill that talks about the certificate of need. In other words, it would open it up to where if new places were wanting to come in, be it hospitals, nursing homes, facilities, they would not be constricted by that certificate of need. So essentially, that's the bill. The act would be effective July 1st, 2024. So with that in mind, unless the committee has any questions before we jump into testimony, seeing none, everybody's ready. Anthony, or Senator Bouchard.
Mr. Chairman, I may have to leave a vote because I have to JCC do an early meeting.
Okay, if you can stay for just a couple minutes anyway. What the plan is, Senator Bouchard, is we're just going to do a half-hour testimony. If we don't get to a half hour, that's fine too. 15 minutes supporting the bill, 15 minutes opposed to the bill, close comment and take a vote. That's the plan. And I have to leave for a couple minutes.
I'm supposed to be in a meeting right now as we speak. So.
Okay, well, we're promised a hurry. Okay, with that in mind, we could flip a coin here and see who goes first, opposition or support. Let's go ahead with support of the bill first. So if we can get those who are in support, there's enough chairs for everybody in the room, frankly. So if anybody else would like to come up in support of the repeal, please come up, introduce yourself. I know who you are, so I don't want to hear the introduction. I will be right back. Senator Dockstader will run the show here for a few minutes. Proceed.
Thank you, Mr. Chairman and members of the committee. First of all, I want to express my gratitude for all of you being willing to look at this piece of legislation again. I know that it is a tough piece of legislation as far as when we're considering nursing homes in our healthcare facilities and what that looks like. Due to some of the testimony being heard in the House and then in particular the Senate Labor Committee, it was a great challenge to me to be able to find out if some of those pieces that I had heard checked out as far as what I could find. And so, Mr. Chairman, members of the committee, I'd send each of you a handout while you're on the floor, but also you should have them at your dais right now. And if I could, Mr. Chairman, members of the committees, I want to walk through that because the largest thing that I heard when talking about this legislation is that this could possibly hurt nurses. The construction of facilities could hurt nursing and nursing jobs and the availability of nurses within these types of facilities. So with that being said, Mr. Chairman, going through these citations are primarily from medical journals. I didn't want to provide you anything that could be construed to be coming from sources that were not respected. So right off the top, Mr. Chairman, members of the committee, the Journal of Applied Gerontology, just from December 13th, 2023, studied con laws, certificate of need laws, and their impact specifically on home healthcare access. And con states have fewer, that certificate of need states, such as Wyoming, have fewer home health agencies for their Medicare population than non-certificate of need states. So there, more options obviously are a good thing in an economy, but you can see that certificate of need does stifle competition and access for Wyomingites as it currently stands. The next piece, Mr. Chairman and members of the committee, this comes from in regards to certificate of need regulation and healthcare service quality evidence from the nursing home industry. And you can see on here, health survey scores for nursing homes that are computed by healthcare professionals are about 18 to 24% lower, depending on the type of nursing home under consideration in states with certificate of need regulation. Certificate of need regulation does not raise the bar. It does not make a better nursing home. In fact, what we're seeing in these studies across the nation is that it actually lowers quality for our residents. Moving on, Mr. Chairman. Additionally, certificate of need regulation tends to reduce the employment of both registered nurses and licensed practical nurses. Mr. Chairman, members of the committee, when it comes to nursing homes, the primary caregivers are licensed practical nurses. And what the studies show is that the number of jobs available are lower in states with certificate of need. By repealing certificate of need, you're protecting those nursing jobs, Mr. Chairman and members of the committee. Studies also showed that period concluded that hospital expenditures were not lower and did not grow at a slower rate with certificate of need programs. The reason I bring that up is that was the original intent of certificate of need, was that it was supposed to contain and constrain those healthcare costs. And what they actually found is it did not meet expectations at all and did not work. And Mr. Chairman, members of the committee, also of note on the last page, if you look at the Journal of Post-Acute and Long-Term Care Medicine, and that's from November 5th, 2019, the ratio of registered nurses to nurses declined initially until the late 2000s, with the highest decline in states with healthcare certificate of need. Once again, pointing out, Mr. Chairman, members of the committee, when it comes to nursing jobs and the employment of nurses here in the state of Wyoming, certificate of need has not protected them, has not grown their capability. It has done the opposite. So with that, Mr. Chairman, members of the committee, I hope I know you all have a ton of reading that you constantly are getting shoved at you. I hope this was helpful as you're considering House Bill 24, and I hope you vote aye.
Question, but I'll ask committee first. Committee questions? Go ahead.
Thank you, Mr. Chair. Tyler, I appreciate all the information you gave us, and I do have a couple questions, especially on what you said this morning, that the certificate of need hurts nurses and nursing jobs. When I hear testimony almost across the board in this committee, you're hearing, we don't have enough staff, we don't have enough staff. We have a certificate of need, and there aren't people coming, just racing in here to work. So can you explain that to me, that statement?
Mr. Lindholm?
Yes, Mr. Chairman, and to Senator Hutchings' questions, I think it's a great question. And I do have, my wife has personal experience in this regard. My wife was a registered nurse at a long-term care facility for a little over 10 years. She's now just graduated with her doctorates in nursing practice. So that job has evolved for her recently, but 10 years in a long-term care facility. And this is something that I went directly to my wife with, as I do all legislation, to find out if she's going to beat me over the head or not. And specifically, she stated to me, Mr. Chairman and members of the committee, which also reflects what the studies actually show, is that certificate of need laws have not improved care access. They have not improved the number of nurses in their communities. They have restricted the number of nurses within their community. And the reason why that is, Mr. Chairman and members of the committee, has to do with the fact that, as we all know, in a free market, when we have availability, when we have choice, there tends to be more choice, there tends to be more options. And the studies do reflect that more nursing home beds, more nursing homes, more availability to access does increase the amount of nurses in the community.
Follow up?
Let me figure out how to phrase it, so if someone else has a question, I'll let them do that.
Senator
Thank you,
Bouchard,
sir.
do you have any questions?
Choice.
How do you think this plays out in our smaller communities? Some they're just fortunate to have a nursing home facility, let alone deal with certificates of need with or for or against. How does this play out in our rural communities across the state?
Mr. Chairman, members of the committee, I think that's a super interesting question because when we're talking about our rural communities, obviously that's near and dear for both yourself and myself. When we're looking at that, and we look at the data that the Wyoming Department of Health has presented, the Wyoming Department of Health states that we have one facility in the state of Wyoming that we would actually be able to build another facility in, right? That means that it is over 85% occupancy, and there's that 30-mile bubble exception also. So that means in the state of Wyoming, if a long-term care facility was going to be built, it could only be built in one community in the state of Wyoming, unless they built outside that 30-mile bubble, which is pretty hard considering where we're currently at and being able to attract business and attract other communities. So, Mr. Chairman, members of the committee, certificate of need will shut down any option in the state of Wyoming except for that one community. And as the Wyoming Department of Health had testified, they have denied the new building of facilities based on certificate of need.
I want to go back to you, but first.
Yeah,
you-
take your time.
You're driven to work on this. Do you have any personal experience? I mean, your wife had mentioned, but what brings you to the table with passion for this?
Yeah, thank you, Mr. Chairman and members of the committee. Certificate of need repeal, and we were fortunate. The state of Wyoming is always better than everywhere else. So certificate of need was repealed for most facilities in the state of Wyoming in the 90s. That was hospitals and a lot of these other entities. They don't have to live up to this barrier. The reason I'm passionate about it is because my wife worked in a long-term care facility. So when I started studying certificate of need, when I heard about it being repealed across other states, I found that Wyoming was ahead of everybody else because we'd already done it back in the 90s, except for this one long-term care facility, with this one group, which made me question and wonder why are we putting this yoke on one type of facility? What is the benefit? What is the good? And that's why I'm so appreciative of the questions that were asked the last time around, because it made me drill in and find journals and studies that actually showed that this is hurting our nursing industry. I'm particularly biased towards nurses because I'm married to one. So that's really where my passion is, Mr. Chairman.
Back to you, Senator Hutchins.
That was actually a really good question because it was kind of something I wanted to know as well. I'm still wondering how this will restrict nurses. So what community, if you can, tell me that we're concerned about, for one, and how, if we do say, okay, we'll lift the certificate of need, you can start building tomorrow, and is there someone wanting to come in and build, and are there nurses standing, waiting in line to go to work in this area? So that's kind of three questions, if you could.
Yeah, Mr. Chairman, thank you. And to Senator Hutchings' questions, I think as far as communities that would like to build, the testimony that we had received prior, that there have been denials for building new facilities in the state of Wyoming in the last 5 years. Those communities, and there was builders and there was private money that was willing to be stood up to build those facilities. But they had to be denied because of certificate of need laws. As far as, does this exacerbate the nursing shortage if we repeal? That's not what I'm contending. I'm contending that this helps nursing jobs, that this helps nurses by having choice. This helps that community. And that's specifically what the studies show. So I think with the existing laws in place, if we were to not pass House Bill 24, we continue to exasperate the situation if we're comparing ourselves to other certificate of need states. That's what the data shows. Conversely, if we do pass this, the data does show that we do actually free up opportunity, and we do have a better and bigger selection. And it also even shows that our ratings go up as far as what those long-term care facilities look like as far as the level of care being delivered.
Thank you, both of you. You know, I didn't get an answer on the community in question, for one. And then again, if this is lifted, I'm still like wondering, does this community, are they wanting a new long-term health care facility? Is that the issue at hand? They want it and they're not satisfied with what they have now? And they think building a new one, they'll just get better services. What do you think will happen, if you can keep track of these questions, to the healthcare facility that's there now? Let's just say I'm working there and wow, there's a new facility. I want to work at this new one. So I'm gonna go apply over there. So I'm gonna take away from the other facility and maybe even lessen the care there. If you can answer those.
Mr. Lindholm?
Yeah, Mr. Chairman, to Senator Hutchings' question, specifically on which communities had tried to build and were denied, I believe I had heard Laramie, the city of Laramie was one of those communities. As far as does the community want it? This is the beauty of the free market, which does not currently exist with certificate of need laws. They were denied that capability. As far as whether or not service goes down in that existing community, what the studies actually show, Senator Hutchings, is that the level of care goes up when you remove certificate of need, that your level of care goes up. Now, correlation is not always causation. It's a study that just shows certificate of need law states tend to fare worse as far as level of care and the number of jobs. So I hope that answers your question. Okay.
Okay, further questions? See none. Thank you, Todd.
Thank you, Mr. Chairman.
Okay, that was all those in support. Let's bring up those who are opposed to the bill. Everybody come up to the table at once that wants to speak in opposition to the bill. Go ahead and introduce yourself and let us know what's on your mind.
Mr. Chairman, committee members, Eric Boley with the Wyoming Hospital Association and Leading Age Wyoming. And we spent a lot of time on this earlier this week. Frankly, I was kind of disappointed that it came back. I think we had a really good hearing at that time. I won't reiterate a lot of what's said. There's a lot to unpack with what Mr. Lindholm just shared with you. And I would have to disagree with quite a bit of what was said, especially when it comes to nursing. But I'll start out by saying repealing this bill or repealing certificate of need, it's easy. You guys can do it at any point and at any time. It's hard not to repeal it, in my opinion, because it's gonna take some work. And I think we need to work on this. We should have spent more time on it in the interim. We should have studied what's going on around the country. We should have looked at the impact of what this might have. We didn't do that. We had some very short hearings on it, and then all of a sudden we're repealing it. We didn't talk about how we could modify existing certificate of need, what it could do, the tentacles that it had. I mean, I think when we looked at this and when the proposal to repeal certificate of need was thrown out there in Saratoga, or it might have been the previous meeting, we didn't realize that this had an impact on our critical access hospitals either. And I guarantee that the national groups that are pushing this and that have an agenda that want to come in and push their agenda into our state politics will be back with this again next year and the year after. But is it right to have an outside group come in and tell us how to run Wyoming? I'm not sure it is. And I think we need to make the decision that's right for Wyoming. My wife and I had a really interesting conversation about this morning. And in the middle of the night, actually, while I was struggling to sleep, while I was thinking about this topic. And whether we believe it or not, this is a huge topic. It's an important topic in our state. We have nursing homes right now that are struggling. They've just come through the pandemic. And they are in some of the worst financial conditions they've been in a long time. Luckily, we got some funding for them last year to bring their Medicaid rates up closer to covering their costs, but they still don't cover those costs. And that's after 10 years of being frozen in place or having reductions in their rates. Our hospitals, Senator Dockstader, you did a great job presenting the insurance look back bill. We have hospitals that if they have a 2% margin, our critical access hospitals, that's a great year for them. Most of them are in the red. And I have fears of what the unintended consequences of repealing this bill would do to them. From the long-term care side of things, I've got statistics and data from all over the country. We heard testimony at one of our meetings about what happened in Utah. They had a moratorium in place. They lifted the moratorium for 4 years. There were new nursing homes that were built down there, and this is exactly what happened in our state with no certificate of need for hospitals. We've had physician-owned hospitals built that competed against the community hospitals. They take only private pay and highly insured, and the rest of those patients stay at the community hospitals. Both of those facilities in Natrona County, one is now owned by the hospital because there was a whole bunch of profit made and then it was sold to the hospital, and the other one is now owned by another hospital. What happened in Utah is new facilities were built and they took private pay and Medicare patients only, and the Medicaid patients were left for the safety net nursing homes in the state. In Wisconsin, the fiscal impact on the Medicaid budget and healthcare utilization went through the roof. It created a two-tiered system, which was what we're talking about, where you've got basically the cherry picking, and then you've got what we consider our safety nets, our community facilities. In Utah, I'll just read a couple of these talking points. Historically, nursing homes have been the main provider of long-term and short-term care services. They had an occupancy rate that declined to 63%, and I think we're close to that as well. Medicaid pays for about 60% of the patients. In our state, it's 70%. And Medicare pays for about roughly 20%, and I think that's still about the same. And then we have the private pay market. Medicaid underfunds on a daily basis. And it's, in Utah, they calculate it was $10 a day. It's higher than that in our state. This is not a free market issue. We are not a free market system. Government controls what they pay for a patient, who can enter the building as a patient, and so they need to control the supply of beds. We're more like a public utility. We can spend a whole lot of time. I've got another study from Michigan, and I'll just share this one, and it actually references Indiana. So they studied this in 2015, and the report concluded that the Michigan Certificate of Need statute and the program has generally served the state well regarding its application to nursing homes and hospital long-term care facilities. The nursing home review standards helps to ensure quality of care and access for all income levels. They encourage providers to use new designs to meet new expectations regarding the best care environment in a nursing facility, and economic activity in the segment of Michigan's economy has been robust throughout the state in the recent past. The report also reviewed the recent experience in Indiana, where repeal of certificate of need led to unforeseen cost increases to the state and invited a series of legislatively enacted short-term moratoria on the construction of new skilled nursing facilities. So Indiana repealed their entire certificate of need program, and then they started seeing their costs go through the roof. And so they incrementally started increasing certificate of need once again until finally they reinstated certificate of need in their state. I just ask that this committee take a measured approach. There is no one knocking on the door, to your question, Senator Hutchins. There's no one knocking on the door who wants to build immediately. And the example that Mr. Lindholm used in Laramie is not exactly correct. There is talk about a desire to maybe build or have the opportunity to build over there, but to my knowledge, no one's requested or is looking at building in Laramie. As far as staffing is concerned, what has been said is not true. Nurses can go anywhere they want. You would be surprised what nurses make now. They can write their own ticket and go to work anywhere that they want. By creating new facilities in our state, we're only going to water down what we have as far as staff is concerned. We've got a huge mandate, and I think Ms. Passano wants to talk about that. We have a mandate that could be imposed as early as next month that will create higher staffing ratios, which will only put our facilities more at risk. So I ask for us to take a measured approach. If we're going to pass this out of committee and we're going to look at repealing it, which I hope we don't, I'd rather study it and make a good decision. I would ask that we either put a sunset date on it so we're forced to come back and look at this like Indiana did, or maybe we can modify existing statute to lower the threshold and see if it has any impact on what happens in the market. With that, I'd answer any questions and I yield any time I have. over to Ms.
Question for
Passmore.
Mr. Boley? Seeing none. Oh,
Comment than a
Senator
question.
Dockstader, go ahead.
I've had the rare opportunity over about 4 decades to watch a hospital grow and finally become profitable. And one of their biggest concerns to date is the weight that comes from trying to keep the existing nursing home that's under the same roof, not literally, but next door, profitable. And you talk about 2%. And if we repeal the certificate, then we got startups that think they want to, can, but can't. And all they do is destroy the existing healthcare facility that works very hard to make it all come together each and every month, because I sit through their board meetings and I know. So that would be my biggest concern. Is that, Mr. Bully, is that what you're hearing from your rural healthcare facilities across the state?
Mr. Boley?
Mr. Chairman, Senator Doxer, it's one of the big concerns, and we talked about it last week, how important, I mean, the model that you guys have in Star Valley, it's a common model when we have hospitals that have constructed nursing homes that are attached. Swing bed is vital to keeping critical access hospitals viable. If you have a new nursing home that comes in and targets those Medicare patients, those skilled patients, the subsidies that are going to have to be used to keep the nursing home afloat will only increase.
Thank you.
Further questions, committee? Seeing none. Ms. Passmore, go ahead, ma'am. Oh, yeah, we got a question. I'm sorry. Hold on one second.
Thank you, Mr. Chair. I'm sorry. My question is, Mr. Boley, it seems like the nursing homes that we do have, they may not be the best from what it sounds like. So if we lifted the certificate of need, the Department of Health says, go ahead and build, someone comes in and builds, those hospitals that are there and the patients that remain there will be in worse shape than better shape, because maybe staff leaves and works in the new hospitals. Is this part of the fear you have?
Mr. Boley?
Chairman Baldwin, Senator Hutchins, I think that's one of the best questions that's been asked in this whole debate. And yeah, I think that's a real concern. And we actually see it play out in certain communities where there is choice and where quality is higher or lower. And I think that one of the conversations that we should have, because this is the Labor, Health, and Social Services Committee, is how do we improve quality? And what can we do? Should we attach quality to certificate of need? Should we force nursing homes to improve the quality of care that they're providing? I think that what you've just described, though, is what we see already playing out in the market, and it'll only get worse if we start adding bright, shiny objects that will attract staff away. I have a fear that it could potentially have a negative impact on the residents that are cared for in those lower quality facilities.
Okay, Ms. Passmore. Follow-up, go ahead.
What can be done, Mr. Boley, with the facilities now? Is it the condition? Is it the staff? Is it the meals? Is it the beds? What is it that's making them unattractive for people to the point where someone says, hey, I'm gonna come in and I'm gonna build something better, and it's gonna stay better? Or is it gonna end up in that loop of, oh, now you're the bad one and nobody wants to live in you? What can be done now instead of this?
The abbreviated answer, Mr. Boley.
I'll try my hardest, Mr. Chairman. Senator Hutchins, another great question. All of the factors that you just talked about weigh heavily on the patient experience or the resident experience. I do think that legislatively, we could do some things to push quality. I think we need a national push, which there's starting to be one. I think we could do something from the statewide perspective. And I think that this adds the value to an interim topic and how we can actually drive that.
Interestingly, Senator, that's one of the suggestions, and we'll talk about that next week, for an interim study is nursing homes, quality of care, et cetera. That's one of the suggestions. That is fine. Ms. Passmore, go ahead, and we're gonna run out of time here pretty quick, but go ahead.
It's off. Oh, it's on. Thank you. I will only address a small portion of what Mr. Boley has been talking about, and I am very much in support of what he has said. we have to remember that 70% of the residents in a nursing home are there on Medicaid. And yes, it's not a free market because the government is controlling what happens for and within a nursing home. It is hard to say that we are not a rural state. And we know nationally that in rural parts of states, that's where the problem arises to have enough staffing. We have not addressed, having spoken with the Nurses Association, with the Board of Nursing, with the Department of Workforce Services. We really do need, and I'm glad to hear that we will have an interim committee subject. It seems to me that I am the one in the room that is the closest to going to a nursing home in age. And I want quality too. And yes, we are all working on quality. And our national association, the American Healthcare Association, kind of beats us on the head with that issue, quality and safety on an ongoing basis. It's not that we're not aware, but the number of nurses that we have that are there permanently make a big difference instead of traveling nurses. And they have cost an arm and a leg for nursing homes in the last 2 to 3 years. We've had to have them because you have to have a staff or you cannot run a nursing home with a number of beds without a certain number of staff. And it doesn't mean just nurses. It means kitchen staff. It means housekeeping staff. And we know that all sectors are vying to find staff to keep their businesses open, not just nursing homes. We in the Wyoming Healthcare Association are all now turning to something called culture change. And that is having residents become the drivers of their own healthcare. They can sleep in, they don't have to get up at 7, they can get breakfast at 9. We are changing our language, and we know that with how we say things makes a big difference on how we act and what we believe. I know that that is not out in the open, but and we need to be writing letters to the editor and op-ed pieces to let the community know that there is a great deal happening that is positive. Thinking about keeping people at home longer, the Department of Health did an 1115 waiver. Certainly, we do hope people get to stay at home as long as possible. But then when you don't have a family in the state and you can't care for yourself anymore, there has to be a place for them, and a very good quality place for them. I am wondering what all the different legs of this whole debate is about. It's much bigger than we have given it credit for having. The one that I am most concerned about right today is the fact that at the federal level, the HHS, CMS, have a staffing mandate that not just Wyoming with this paucity of population, but across the nation, nursing homes cannot meet that mandate. It's in the mix at this point, and we know that there is a bill that's coming forward to try to deep six that mandate on staffing ratios. We are not there yet, and that's why this bill is not appropriate at this time. Nursing homes cannot fight for their life and their residents' lives when they're facing too many issues from government, be it federal or state. So I know that you're anxious to get out of here. I won't keep going. Just asking that you consider the many things that are impacting this issue. They're not easy. They have not been thoroughly discussed. And perhaps when we do that together, we're going to find some nuances that we want to change. At this time, I hope not at all. Thank you.
Question from Ms. Pascal, Senator Hutchins.
No. Two questions. Lifting the certificate of need, will that in any way bring down the cost of the nurses, the price that they demand? One. And number two, if we lifted this certificate of need today, what would be the immediate issue for the community that you're advocating for? What would happen now? Would they know that it was even lifted? Is there gonna, again, what's gonna be the immediate effect?
Ms. Pascal.
Senator Hutchings, Mr. Chairman, the people that are employed in nursing homes in Wyoming Healthcare Association are very aware this bill is before you. And they are concerned about where their jobs are going to go. Who's going to come in with lots of money, build a shiny new nursing home of 15 beds and take away their staff and their residents. And then they have a building to keep up, and there's not enough money coming in. And they have been hard hit with COVID. I know that the public doesn't understand that, but they are just now coming out from under that burden. And I have 2 of 13 that are through that, and they have enough staff. They're bringing in enough money. They're feeling secure. That means most of them are not. We need to give them time to get back where they were before COVID hit them. And I know that our thoughts go before us rather than finding what really is true within a nursing home. We have staff that have been there 10, 20, 30 plus years. You know that there has to be something good there, or they would not stay so long. In fact, some of the things that happen is the staff become almost like family to the residents. And it does become a family. We don't want to disturb that. I don't want to disturb that. And we need to let people know what really is happening within a nursing home. It's not frightening. It's not bad. We need to say what it really is.
Thank you.
Thank you, Ms. Pascal. Quick comment.
Mr.
Bowling?
Chairman, just in response to your question, Senator Hutchins, as far as what will happen with wages, we've already seen that. So we've talked about the fact that the state has the ability to go around certificate of need. And we've had a couple of state-run facilities that also have competition from the market. In those communities, it's been a battle of wages between the state facilities and between the private facilities. And so it's only going to exacerbate the problem, in my opinion. Thank you.
Okay, thank you. Thank you very much. The best part of that testimony was sleep in, breakfast at 9. I stuck right there. Thank you for that. Okay, that closes the testimony. What I would like to do is bring Department of Health up real quick for a couple questions or answers perhaps. And you were looking lonely back in that part of the room. First of all, go ahead and introduce yourself, and if you have any comments on what you've heard so far or anything about the bill, go ahead, Director.
Good morning, Mr. Chairman, members of the committee. Stefan Johansson with the Wyoming Department of Health. joined by Laura Hudspeth, our head of the Office of Healthcare Licensing and Survey. I won't repeat our testimony from a couple of days ago, but we are here to answer any questions you might have.
Very good. Questions, committee? Senator Barlow.
Thank you, Mr. Chairman. So my interest is what types of facilities is this being applied to now? This 85% rule, 30 miles, anyway, this certificate, what facilities is it being applied to? Thank you, Mr. Chairman.
Mr. Chairman, Senator Barlow, to nursing facilities only.
Senator Barlow.
So thank you, Mr. Chairman. So when I read the statute and I refer back to the definition of a nursing care facility, it also includes assisted living care. So my question is this being applied the way the statute seems to read clearly to me? Thank you, Mr. Chairman.
Director.
Mr. Chairman, I'll defer to Laura Hudspeth on that question. I do know, Senator Barlow, we apply the certificate of need right now only to nursing homes.
Laura, go ahead.
Yes, Mr. Chairman, Senator Barlow, in terms of the definition, it says nursing care facility means a facility providing assisted living care, rehabilitative care, and related services. So in other words, a nursing care facility can provide assisted living level of care as well as a higher level of care. And then there's another definition for an assisted living facility, which means a dwelling.
Follow-up?
Mr. Chairman, I certainly can read that. I just don't know that it's being applied the way the law is written. And that's my frustration. And that's why I voted to bring this back, because when I read the statute, when I read the, what we're talking about striking, and I don't need a response from the department. My frustration is I don't believe if we're not doing it with assisted living facilities, period, then I don't know that we're being consistent with how this current statute's being applied. Thank you, Mr. Chairman.
Good. Are there any questions we need answered from the department? Senator Hutchins? Nope. Nope, okay. Okay, thank you very much. We'll close public comments. Committee, what's your pleasure?
Mr. Chairman, I'm not going to make a motion to pass. I'm speaking from one who has lived this to the ground. In my other occupation, I spend a lot of time in hospital board meetings. I understand the difficulties they have, and this would only add to their difficulties at the rural health care level. I oppose it now, and I oppose it in the interim for a discussion topic.
Okay. Does anyone want to move the bill? Would be the question. Seeing no move the bill. Comment. You look like you want to say something.
Mr. Chairman,
Go ahead.
I still think there's an inconsistency, and I want to understand it better. Therefore, I'm not going to move the bill, because I don't want to I don't want to further something that I don't know that is being done correctly now. And that's my concern with moving this bill. I actually don't have as much problem. I would rather actually raise the reimbursement rates, and maybe we can get rid of this, and that's something I've told many advocates. I'm all for that, but right now, my concern is the applicability of current statute. Is it being applied appropriately? Thank you, Mr. Chairman.
Thank you. Okay. That bill will not be voted on. Okay, thank you. Thank you, committee. This was our last committee meeting, except that we have a joint meeting next week to discuss interim topics on Wednesday, I believe. I'll have to look and see.